Hello everyone. Today we are going to talk about cultural diversity in nursing. Now, before I start, let me ask you something. How many of you have cared for a patient from different religion, language or different background? All of you will face this in clinical practice every single day, right? So, understanding how culture affects your patient and your nursing care is too optional. It is important and essential. I am Brinda Ronika, working as a tutor in Tribhulam College of Nursing. Objectives of today's section is define culture and cultural diversity, explain its importance in nursing, describe the major transcultural nursing theories, identify the barriers to culturally competent care, and discuss strategies to deliver it. All five are directly connected to your clinical work. Okay, now we'll start this section. First one is a definition. We'll see some of the definitions here. First one is a culture. So culture is a learned shared values, beliefs, norms and practices of a group that guide their thinking and behavior. Simply put, it is how a group of people live, think, eat, pray and make decisions together. And the second definition is cultural diversity. It is the differences among people based on race, ethnicity, religion, language, and beliefs within a care setting. In a hospital, you will have a patient from many different backgrounds, all in the same ward. That is cultural diversity. And the third one is transcultural nursing. Is a discipline focused on providing care that is congruent within the patient cultural values and beliefs. Congruent means matching. Your care must match what the patient believes and values. That is transcultural nursing. Now, why does this matter in nursing? There are five reasons are they. First one is it promotes holistic patient-centered care. You are not just treating the disease. You are caring for the whole person, including their cultural identity. Second one is it reduces health disparities. When nurses understand diverse population, they can identify and reduce inequalities and healthcare access and outcomes. Third one is it builds trust and improves communication. A patient who feels understood and respected opens up, communicates better and cooperates with the treatment. Next one is it increases patient satisfaction and treatment complaints. Like a Muslim patient whose dietary restrictions are respected will trust you more and follow your advice more carefully. And the last one is it supports ethical, legal, and professional standards. Respecting culture is not just good practice, it is a right thing to do ethically and professionally. Okay, before the theories, let us understand five key concepts quickly. Cultural awareness, which means recognizing your own culture and how it influences the way you see others. First step is knowing yourself. Second one is cultural sensitivity, which means respecting and valuing cultural differences even when they are different from your own. Third one is cultural competence, which means actually being able to provide effective care across different cultures. That is a goal we are working towards. Fourth one is a ethnocentrism, means believing your own culture is superior to others. This is dangerous in nursing because it leads to dismissing the patient's belief and values. And stereotyping, last one, which means generalizing beliefs about a cultural group and every single member of that group. Not every patient from a particular community thinks or behaves the same way. Treat each patient as an individual. Now we'll move into the three important transcultural nursing theories. First one is Leninger's Sunrise Model. Dr. Madeline Leninger is the founder of transcultural nursing. Her model is based on the cultural care diversity and universality theory. The Sunrise Model shows that multiple factors influence the patient health and care needs, including technology, religion, family relationship, political and economic factors, and education. The goal of this model is to provide care that is culturally congruent, meaningful, and beneficial to the patient. Think of the sunrise as representing all the different factors rising together to influence the patient world. Second is Punnell's model. This gives nurses a systematic framework of 12 cultural domains to assess patients. The domains include communication style, family roles, nutrition and food practices, spirituality, pregnancy practices, death rituals, and healthcare practices, among others. By going through these 12 domains, the nurse builds a complete cultural picture of patient and plans individualized care accordingly. Third is Giger and David Zihar model. This is built around 6 cultural phenomena: Communication covers language, tone, and nonverbal cues. Space covers the patient comfort with physical closeness, which varies greatly across cultures. Then social organization, it covers family and community roles. Then time, it covers orientation to time. Some cultural are very time focused and others are not. Then environmental control covers the patient beliefs about their ability to control their own wealth. And biological variation, it covers physical differences between the cultural groups and affect health outcomes. So this is a very important three theories in transcultural nursing. Now what are the barriers that prevent culturally competent care from happening? Language differences and communication gaps are biggest barrier. If you cannot communicate with your patient effectively, you cannot give safe care. Stereotyping and unconscious bias means we make assumption about patients without realizing it. Limited cultural knowledge or training means many nurses have not been taught enough about different cultures. Time constraints in busy clinical setting mean nurse rush and skip throughout cultural assessment. And personal ethnocentrism means some healthcare providers consciously or unconsciously believe their own cultural approach is the correct one. So recognizing these barriers in yourself and your workplace is the first step to overcoming them. Okay, now we'll see how culture directly affects patients understand and respond to illness in five major ways. First, their perception of illness and healing, meaning what they believe causes disease and what they believe cures it, is shaped entirely by culture. Second, dietary habits and food restrictions must be respected during hospitalization. Third, religious and spiritual practices during illness must be accommodated. Fourth, family involvement in healthcare decision is very important in many cultures, and the patient may not make any decision without consulting the family. And attitudes towards pain, expression, death, and dying vary enormously across culture. Some cultures are very expressive about pain and others not. Okay, now we'll see the nurse role in cultural diversity. As a nurse, your role in cultural diversity is four things: advocate for the patient cultural values and preference within the healthcare team, communicate with openness, empathy, and respect at all time, collaborate with the family and community support systems that are important to the patient, and pursue continuing education in cultural competence, because this is a skill that you build throughout your career. Thank you.